Anxiety and coping techniques. Hello. This is Psychology Pro. One of the most common psychological disorders is anxiety disorder. If you feel too worried, stay with us. According to Diagnostic and Statistical Manual of Mental Disorders, 5th edition or DSM-5, a person has an anxiety disorder who has these conditions: excessive anxiety and worrying apprehensive expectation occurring more days than not for at least 6 months about a number of events or activities such as work or school performance. B. The person finds it difficult to control the worrying. C. The anxiety and worrying are associated with 3 or more of the following 6 symptoms, with at least some symptoms present for more days than not for the past 6 months. 1. Restlessness or feeling keyed up or on edge. 2. Being easily fatigued. 3. Difficulty concentrating or mind going blank. 4. Irritability. 5. Muscle tension. 6. Sleep disturbance, difficulty falling or staying asleep, or restless, unsatisfying sleep. D. The focus of the anxiety and worrying is not confined to features of an axis I disorder. For example, the anxiety or worrying is not about having a panic attack as in panic disorder, being embarrassed in public as in social phobia, being contaminated as an obsessive-compulsive disorder, being away from home or close relatives as in separation anxiety disorder, gaining weight as in anorexia nervosa, or having a serious illness as in hypochondriasis. And the anxiety and worrying do not occur exclusively during post-traumatic stress disorder. E. The disturbance is not attributable to the physiological effects of a substance, for example, a drug of abuse, a medication, or another medical condition, for example, hyperthyroidism. If you have the mentioned conditions, my advice is to consult a psychologist, but if you have some of the mentioned items or want to deal with your momentary anxiety, don't miss the continuation of the video. Anxiety techniques. First technique, 333. It's an easy technique to remember and use in the moment. It's available to us the majority of the time, and it can be a simple strategy to help us focus and ground when anxiety overwhelms. Put simply, you name 3 things you can see, 3 you can hear, and move 3 different body parts. Second technique, 555. The 555 rule is a simple breathing technique where you breathe in for 5 seconds, hold that breath for 5 seconds, and then exhale for another 5 seconds. It's like giving your mind and body a gentle reset, a moment of pause in the hectic rhythm of life so that you can bring clarity and tranquility back into focus. The third technique, 5 4 3 2 1. The 5 4 3 2 1 or 5 4 3 2 1 method is a grounding exercise designed to manage acute stress and reduce anxiety. It involves identifying 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. Other ways. According to the researchers, these ways can also be effective in managing anxiety. Learning about anxiety. Concentration, relaxation techniques, correct breathing techniques, diet adjustment, exercise, learning assertiveness, building self-esteem, cognitive therapy, exposure therapy, structured problem solving, medicine and support groups. I hope you are always healthy and happy. Subscribe us and activate the bell to be aware of our new videos. Thank you for your support and like. Ask your questions in the comments.